Hello everyone, welcome to World Nursing Lecture Room. Today's session we will be discussing about pregnancy. What someone, or if you get pregnant, you should expect in the first trimester, second trimester to third trimester. The lecture or this lecture is designed to provide semester by semester overview of pregnancy, highlight maternal changes, fetal development, and key nursing consideration throughout these stages. So whether you are a nursing student, a practicing nurse, or educator, this video will enhance or will help you understand clinical approaches to antenatal care, and also it will help you to understand how to deal or how to help someone who is expecting, how to deal with those changes that take place when someone is pregnant. So let's begin. If you have not subscribed, kindly subscribe, like the video, share, comment. Don't forget to turn on the notification bell so that every time I post a video, you will be the first person to be notified. So let's begin. So most of the time, if you hear about pregnancy, it means you have missed your period. You have missed your period. It means you are carrying a baby. It means whether this pregnancy, sometimes you don't know whether this pregnancy is going to be normal or abnormal. We have so many challenges that usually happen during the first trimester, second trimester, and third trimester. So before we indulge into that, let us look at some of the signs and symptoms that will happen or will take place when someone gets pregnant. Immediately you miss your period, most of the people run to get a pregnancy test. Some go to the hospital to get tested. Some do home tests, which most of the time can be inaccurate. So when you get pregnant, the first sign that you will experience is missed period. If you are in this channel and you don't know signs and symptoms of pregnancy, then you should get out. You get out. Go and learn about signs and symptoms of pregnancy or pregnancy symptoms before you come and listen to this video. Anyway, I was just saying that. So let's learn some of these pregnancy symptoms that someone may experience. Missed period, the first sign. The second sign is nausea and vomiting. Sometimes people call it morning sickness. I don't know the reason why they gave it that name of morning sickness, because this nausea and vomiting can fuck your day and night. So it usually happens because of the changes in the hormones. You know, when we are pregnant, there is fluctuations of the hormones. So most of the time you will get morning sickness or nausea and vomiting because of the hormones. Breast changes, breast tenderness also will happen because of the hormones, progesterone and estrogen and other hormones that involved in pregnancy. Fatigue because of the hormones. Another one is frequent urination because your kidney is now doing a lot of work. Also, food craving and food aversion. Some people may like some food so much, and some people may even don't want to see or to feel or to get even close to some of the food. Mood swing because of the hormone. Also bloating and cramping sometimes, especially in the later stages of pregnancy. Light spotting usually happen from 6 to 12 weeks after conception because implantation is taking place. And also sometimes you can realize an increase in basal body temperature. Those are some of the signs and symptoms that a mother, when you're pregnant, or a mother when a woman is pregnant, will experience all those signs. Now, what are you supposed to expect in the first, second, and third trimester? So you have to know that pregnancy is divided into 3 stages, from the time you conceive to the time you deliver. So therefore, you have to know that this trimester has 3 months or 12 weeks each. And each trimester, you will experience different changes in your body. And some may disturb or may interfere with your daily activities. So let us look at what you can expect in the first trimester and how will you deal with these things when they occur. So the first one is nausea and vomiting. In the first trimester, you will experience nausea and vomiting, and fatigue. Urination also will be more. Breast tenderness also will occur. Also, in the first trimester, you can experience physical changes where you might have a significant weight gain or weight loss. Some people lose weight because of the nausea and vomiting. They vomit a lot and they cannot even take some food, or they are not able to feed themselves because of the hormones in fluctuation. So there will be a significant weight changes. Some people eat a lot, some people don't. So you can lose weight, you can increase weight, or you can have a lot of weight, and all this is caused by the hormones. Also, you can have some emotional changes. You can have anticipation and excitement, but also anxiety and mood fluctuation will set in. So those are some of the things that some of the things that someone will expect in the first trimester. If you deal with all those morning sickness, fatigue, frequent urination, breast tenderness, mood changes, physical body changes, increased body weight or increased weight loss, how you will deal with them? How do you deal with nausea and vomiting? Eat small frequencies of food, and also you can put ginger in your food. And vitamin B supplement is also important. They help you or reduce the nausea and vomiting. Fatigue, prioritize sleep. Sleep, my dear, you are carrying the baby. Can you sleep? why are you walking left, right, and center, and you're carrying the baby? Kindly sleep, have your good time, have rest, sleep as much as possible. Also, with hydration, drink plenty of fluid as much as you can. Yes, drink plenty of fluid, so that you don't want you so that you prevent dehydration. Also, there is prenatal care in the first trimester, where you start taking prenatal vitamin, prenatal medication. Those folic acid, they are very important because they prevent fetal malformation. They also help with prevention of anemia in pregnancy, and also they help in fetal development. Yeah, so those are the things that you should do, or how you can do. Those are some of the things that you're supposed to do in the first trimester, and how you can deal with the changes that occur in the first trimester. In the second trimester, from 13 to 27 weeks, a decrease in nausea and vomiting you can expect that, but you may experience back pain, heartburn, pelvic discomfort. You might also begin to feel the body movement of the baby, and also physical changes will occur, where your belly will start growing. If you had had a significant weight loss in the first trimester, this is the trimester that you will start gaining weight. And also stretch mark will be possible. Skin pigmentation, some people will experience that. Also, there will be generally more stable mood and increased excitement about the pregnancy. So those are the things that you can expect in the first trimester. So how do you deal with all this? Physical discomfort. Incorporate light exercise like walking, swimming to elevate discomfort. Also, ensure that you consider prenatal yoga and relaxation and flexibility. You can focus on the balanced diet, food rich in fruits, vegetables, proteins, whole grains, to support the growth of the baby. Another thing that you can also focus is start planning and preparing for the baby arrival, where you will start. You can write down what you want your baby to have: the clothes, the blankets, everything, the baby essentials that you will need when you are about to deliver. You must continue with your prenatal care. Yeah, you must continue attending antenatal care, where you should go for your antenatal clinics. You take those medication, folic acid, the iron folic acid. So I don't know even where I was, but I think I was talking about the preparation for the baby, where you do the shopping. Now you start doing the shopping. So it is always recommended that you start doing the shopping as early as possible, so that you don't get overwhelmed, or you don't think, how do I put this, so that you don't find it difficult when you are in the third trimester, where now you are tired, you have a lot of things to shop. Sometimes there are a lot of things that are happening in the third trimester, so it's always advisable you start shopping in second trimester, in fact even in the third trimester, so that you avoid a lot of exhaustion when you are in the third trimester. This third trimester is also advisable that you go and check the gender of your baby, so that you know the clothes that you are going to buy. Sorry. Yeah. Anything about like heartburn, you can have leg cramp, back pain. Those ones you can just rest a bit. Yeah. If it is about the stretch mark after you deliver, some some of the body changes that usually happen will go away after giving birth. So don't worry about so much of them. Heartburn, you can avoid the trigger, and also you avoid eating, and then you go and sleep immediately. So in the third trimester, physical changes, where there will be an increase in discomfort as the baby grows. This will include more pronounced back pain, shortness of breath, swelling in the feet and ankle, frequent urination. We said frequent urination is because of so much activities of the kidney. A lot of kidney is functioning a lot, so that is the reason why you will have frequent urination. Also, shortness of breath will be brought by the baby is pressing the diaphragm, so you get that there is the room of the lungs is reduced, so you find that you struggle to breathe. Also, about the back pain, you can just have a little sleep, or you can take a nap most of the time. I said you have to sleep, bro. You have to sleep. Yeah, you have to sleep when you are pregnant, so that you rest well. Another thing that how you can tips to cope about all this discomfort. In the third trimester also you will have Brandopsis contraction, may occur or may not start occurring at least, but you can also start experiencing some signs of labor in the third trimester. There will be discomfort, so coping with discomfort, breathing techniques, stay organized, also will be needed when you are in the third trimester. About the discomfort, use pillow for support to sleep. Use several pillows to support yourself to sleep. Take a warm bath to ease the discomfort. You can consider small exercise like walking, swimming, gentle exercise. Yeah. Also, with the breathing technique, practice breathing exercise and relaxation technique that can help during the labor. Also, you can stay organized. Start packing your start packing your hospital bags. Put everything in place. You know, this is the time you are expecting labor anytime, so start packing your bag. Make sure everything is organized. Make sure you have all the things, everything that you will need when you have your baby. You have already shopped for them. Yeah, and be aware of signs and symptoms of labor in the third trimester. No, when you know labor can start anytime, so be aware of signs and symptoms of labor. So general tips for all this trimester, make sure general tips for all this trimester, make sure you have your prenatal care. So what I'm trying to say, how you can deal with all this trimester, first trimester, second trimester to third trimester, prenatal care, where it will involve visiting the clinic, finding how your baby is doing, taking medication. Yeah. We also consider education, consider taking education about the child, about the pregnancy, so that you know, you are aware of danger signs in pregnancy. Yeah, you are aware of danger signs in newborn. You are aware of so many things. Consider taking education. Also, exercise is very important. Eating healthy diet. We will discuss the diet or the specific food that you are supposed to eat when you are pregnant. So stay tuned. Make sure you subscribe so that every time we post a video you are updated, and let's meet in the next video. Bye till next time.